Welcome back. In global tallies of COVID-19 infections and deaths, one country is conspicuously absent. North Korea maintains it has 0 coronavirus cases. Christine Chan tells us more.
On January the 13th, the first case of COVID-19 outside of mainland China was recorded in Thailand. By January the 20th, infections had skyrocketed in China. North Korea closed all its borders, banned foreign tourists and all flights in and out of China, intensifying the screening of their residents, isolating those with symptoms in the first national lockdown in the world, 3 days before Wuhan was shut down. Health experts have carefully watched for signs that the novel coronavirus may have spread from China to North Korea, especially through the largest Chinese city along the North Korean border, Dandong.
Dandong is the largest Chinese city along the North Korean border, so an estimated 70% of trade between China and North Korea flows through Dandong.
Inevitably, the movement of people, of goods and services through this border thoroughfare would have exposed some 880,000 people, on a conservative estimate, to the risk of COVID-19 infection. From his self-isolation in the mountains of Utah, Dr. Kee Park, global health expert and longtime trainer of doctors and surgeons in North Korea, tells me.
I think it's a massive threat. It's a huge public health threat, what their death toll could be. And for North Korea, it was as high as 150,000 deaths inside their borders. If COVID-19 were to sort of, explode, if you will, and then the number of beds that they would need, hospital beds, it would exceed their current capacity. For instance, the ICU numbers, at a minimum, they would need 2,500 ICU beds. And the implication is that these are, ventilator-equipped ICU beds. They don't have that. And so this is a huge threat, and it will remain to be a threat for some time to come until we have good therapeutics or vaccine.
All healthcare services in North Korea are organised and funded by the state, predictably the subject of international scrutiny and skepticism for a very long time. Few outside of Pyongyang truly believe that the ordinary citizen has sufficient or adequate access to regular sources of nutrition or sustenance, let alone timely medical treatment, with the exception of the ruling elite. The World Food Programme says about 40% of the population in North Korea is undernourished. Food insecurity and malnutrition are widespread there, which makes the prospects of contracting COVID-19 if you live in North Korea, still subject to sanctions, with the global pandemic raging on around it, terrifying, to say the least.
Based on the way they're behaving, right, the public health policies and the restrictions, there's a certain amount of confidence in their ability to contain the virus. They're not going to be very careless about these things. They are super risk averse, so they won't relax these measures unless they feel fairly confident that if there is an outbreak, it's still contained. There's the prevention, and then there's the treatment. And the better you are at preventing, the less treatment capacity you need. So North Korea is doing both. They're actually trying to increase treatment capacity by building hospitals. They're clearly, investing in oxygen generation capacity and those kinds of things. And then at the same time, they're trying to keep the borders locked down, quarantine measures, these kinds of what we call non-medical countermeasures. They're actively applying both, but there's a gap in treatment capacity, and they're going to try to build that up as quickly as possible.
Dr. Park will also be working as quickly as possible on returning to North Korea. Since 2007, he's made more than 20 trips there to teach and train the doctors, most recently in November of 2019.
North Korean doctors are super capable. They're amazing. It's really the geopolitical climate that prevents the health of North Korean people from improving. I like to say peace is a prerequisite for health. And the absence and then the failure to achieve a peace on the Korean Peninsula directly impacts how the vulnerable population in North Korea, the clean water, basic medical needs, even food insecurity. These are all directly impacted by the fact that there's still an ongoing war. So, that's the greatest challenge, in my opinion, is can we get to peace, a sustainable peace regime on the Korean Peninsula? Then I can work alongside the North Korean doctors. And our enemies, not each other, but the disease or the injury that is inflicted to the patient.
Even if no one in North Korea has yet been infected, Kim Jong-un's dream of achieving self-supported economic development by leveraging a nuclear arsenal may already have been frustrated by this coronavirus unseen to the naked eye.